Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Medical management of androgenetic alopecia, which is also known as patterned hair loss. We will give minoxidil for both men and women, along with that with or without addition of anti-androgen. First, coming to minoxidil, it was first being used as an antihypertensive to treat hypertension. It was found to have a side effect of hypertrichosis, which led to its development as a topical agent for hair growth. To utilize this side effect of hypertrichosis, then they have developed topical formulations like 2% and 5% solution and 5% foam. Coming to its mechanism of action, it increases the duration of anagen growth phase and gradually enlarges miniaturized vellus hair to terminal hair. What happens in androgenetic alopecia? Because of the effect of androgens, all the terminal hair will miniaturize to vellus hair, small thin hair. Now this minoxidil is reversing that, converting vellus hair again to terminal hair. First, when we give minoxidil, all the vellus hair which are ready to shed off will shed off. That patient may perceive as he has got increased hair fall, but it is not true hair fall. It is apparent hair fall. Actually, after 2 to 3 months, hair will start growing slowly. Only after 6 months, we can assess whether minoxidil is working or not. Until then, we have to use consistently. It is a potassium channel opener which causes vasodilatation. It will also stimulate vascular endothelial growth factors, prostaglandin E2, which stimulates hair growth. Coming to FDA approved use, androgenetic alopecia. For males, we can give either 2% or 5%. For females, we have to give only 2%. Off-label uses: alopecia areata, loose anagen syndrome, congenital hypotrichosis. We can use minoxidil before and after hair transplantation. Before hair transplantation, it functions. It improves the functioning of suboptimal follicles. After hair transplantation, it increases the survival of transplanted follicles. After hair transplantation, we should restart minoxidil only after 1 week. Coming to adverse effects of minoxidil: irritant and allergic contact dermatitis, hypertrichosis. For hypertrichosis only we are using, but here this hypertrichosis is not on the scalp. If we apply inadvertently other than scalp, there and all we can get hypertrichosis. Coming to anti-androgens. The main culprit in androgenetic alopecia, name itself telling us it is androgen. So we can also add on an anti-androgen. Spironolactone. It reduces androgen synthesis and androgen receptor. It is an androgen receptor inhibitor. It also inhibits 5-alpha reductase. So mainly spironolactone is a androgen receptor inhibitor. It is used as a diuretic, mainly FDA approved use. Only off-label we are using for androgenetic alopecia, hirsutism, acne, hidradenitis suppurativa. All these 4 diseases are related to androgens. Coming to adverse effects, it may cause GI abnormalities, hyperkalemia. It is a potassium sparing diuretic. It will eliminate all the sodium and water from the body but holds potassium, which may lead hyperkalemia. Every anti-androgen will cause decreased libido. Without androgen, there won't be any libido. And gynecomastia. Men may attain features of females like breast gynecomastia and feminization of male fetus. So we should avoid it in pregnancy. If androgens are present, fetus will form a male fetus. If absent androgens, then it will become obviously female. It will attain obviously female external genitalia. Next, cyproterone acetate. It is a teratogen. It is also an androgen receptor inhibitor. Same, flutamide is also an androgen receptor inhibitor. Until now we have seen 3 androgen receptor inhibitors: spironolactone, cyproterone acetate, flutamide. Same, cyproterone acetate is used off-label for androgenetic alopecia, acne, hirsutism. Flutamide also for same off-label uses. Both will cause hepatotoxicity. Flutamide will cause fatal hepatotoxicity. Next, 5-alpha reductase inhibitors. 5-alpha reductase has 2 isoenzymes, 1 and 2. Finasteride inhibits second isoenzyme. What is this 5-alpha reductase? It will convert testosterone to more potent form, that is dihydrotestosterone. It is the main culprit. More than testosterone, dihydrotestosterone is the main culprit. Now here it is inhibiting this formation of dihydrotestosterone. It has got FDA approval for androgenetic alopecia in males. Remember, for males we can add an anti-androgen, that is finasteride only, because it will work. This enzyme is present mostly on frontal area and vertex area, which is male patterned baldness. For females it is off-label use for hirsutism, acne and hidradenitis suppurativa also. As with any androgen, will decrease libido, gynecomastia. Dutasteride, name itself telling us dew, it will act both isoenzymes 1 and 2. Off-label we can use it for all here: androgenetic alopecia, hirsutism, acne, hidradenitis suppurativa. Along with these 4, one more: frontal fibrosing alopecia also. Next, ketoconazole. We all know it is an antifungal at 200 mg dosages. Now here we are giving high dosages, that is 400 to 600 mg. Only at these high dosages it will inhibit this CYP3A4 enzyme and inhibits androgen biosynthesis. In androgenetic alopecia, ketoconazole shampoo can be used as an adjunct to minoxidil. Then it is used in hirsutism also. Side effects are headache, hepatotoxicity, hair loss and nausea. Combined oral contraceptive pills, preferably third and later generations. First and second generations will have progesterone, which we can't use for controlling androgen. It will have androgenic effects. Later, third generation, later on generations, they will have anti-androgenic effect. Now we want anti-androgenic effect, so we will use only third generation more. It is a category X drug. It inhibits LH, FSH, ultimately inhibiting androgen synthesis. Same with GnRH analogs. If we give GnRH analogs like leuprolide acetate continuously, it will also inhibit LH, FSH, ultimately inhibiting androgen synthesis. No androgens, no androgenetic alopecia. FDA approved use for OCPs are acne. Off-label you can use it for androgenetic alopecia in female, hirsutism. Same with GnRH. OCPs are prescribed only when female does not want to conceive. Side effects are headache, melasma, migraine, increased risk of venous thromboembolism. We all know estrogen causes this increased risk. GnRH analogs causes hot flushes, osteoporosis. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.